Here is a detailed explanation of human papillomavirus HPV infection. Introduction. Human papillomavirus HPV is a DNA virus from the Papillomaviridae family, known for infecting epithelial cells of the skin and mucous membranes. It is considered the most common sexually transmitted infection, STI, worldwide. Although most HPV infections are transient and asymptomatic, persistent infection with certain high-risk types can cause malignancies, notably cervical cancer. In addition, low-risk types cause benign lesions like genital warts. Effective prevention strategies include vaccination, screening, and public education. 2. Definition. HPV infection refers to the presence of the human papillomavirus in the body, typically affecting the epithelium of the skin, anogenital area, or oropharynx. HPV is classified into high-risk, oncogenic, and low-risk, non-oncogenic types. The infection can remain latent, become clinically apparent through warts, or progress to dysplasia and cancer. 3. Etymology, human, pertaining to humans. Papilloma, derived from Latin papilla, nipple, and Greek oma, tumor, describing wart-like growths. Virus, from Latin meaning poison or slimy liquid, referring to infectious agents. 4. Epidemiology. Globally, more than 600 million people are estimated to be infected with HPV. 80% of sexually active people are likely to acquire HPV by age 45. HPV causes 99.7% of cervical cancers, 70% of oropharyngeal cancers, 90% of anal cancers, 90% of genital warts. Peak incidence is observed in young adults aged 15 to 24 years. Women are at higher risk of cervical complications, especially in regions without screening programs. Types. There are over 200 genotypes of HPV grouped into A. Low-risk types. Do not integrate into the host genome. Cause benign lesions like genital warts, common warts. Common types, HPV 6, 11. B. High-risk types. Can integrate into host DNA and promote malignancy. Cause cervical, anal, oropharyngeal cancers. Common types, HPV 16, 18, 31, 33, 45. C. Cutaneous types. Cause common skin warts, HPV 1, 2, 4, 27. D. Mucosal types. Infect genital, anal, and oral mucosa, e.g. HPV 6, 11, 16, 18. 6. Causes. Caused by infection with HPV through sexual transmission, vaginal, anal, oral, skin-to-skin contact during intercourse, fomite transmission, via surfaces or instruments, rare, vertical transmission, mother to baby during delivery. Now some risk factors. Early age at first sexual intercourse, multiple sexual partners, engaging in unprotected sex, immunosuppression, e.g. HIV, AIDS, organ transplant recipients. Smoking reduces immune response in mucosa. Co-infections with other STIs, e.g. herpes simplex virus. Not receiving the HPV vaccine. 8. Complications. Cervical cancer, most common HPV-related cancer. Anal, penile, vulvar, vaginal, and oropharyngeal cancers. Genital warts may recur even after treatment. Respiratory papillomatosis in infants from vertical transmission. Emotional psychosocial impact. Anxiety, depression, social stigma. Infertility due to cervical surgical procedures for dysplasia. 9. Pathophysiology. Step by step. Inoculation. Virus enters the basal epithelium through microabrasions. 2. Infection. HPV DNA enters host cell nucleus and begins replication. 3. Viral genome maintenance. Viral DNA replicates episomally outside the host DNA. 4. Expression of early proteins. E6, E7. E6 binds and degrades P53, a tumor suppressor protein. E7 inactivates RB, retinoblastoma protein, promoting cell cycle progression. 5. Immune evasion. HPV avoids immune detection by not causing lysis or viremia. 6. Persistent infection. Failure of immune clearance leads to integration of viral DNA into host genome. 7. Dysplasia and neoplastic transformation. Continued cell proliferation leads to intraepithelial neoplasia and eventually cancer. 10. Signs and symptoms. Most infections are asymptomatic. Genital warts, small, soft growths in the genital anal area, may be single or clustered, cauliflower-like. Cervical dysplasia, usually asymptomatic, detected by abnormal pap smear. Cancer symptoms, cervical, abnormal vaginal bleeding, pelvic pain, oropharyngeal, sore throat, hoarseness. Anal, pain, bleeding, lumps. Hack 11. Diagnosis, physical examination, visible warts, Pap smear detects cervical cell abnormalities, CN123. HPV DNA testing identifies high-risk HPV types. Colposcopy, visual exam of cervix with magnification. Biopsy for confirmation of cancer or dysplasia. Anal penile oropharyngeal screening in high-risk groups, e.g. MSM, immunocompromised. Nursing diagnosis, risk for infection related to unprotected sexual activity. Impaired skin integrity related to wart lesions. Anxiety related to positive HPV test or cancer diagnosis. Knowledge deficit about HPV transmission and prevention. Disturbed body image related to presence of genital warts. 13. Medical management. Topical agents, podophyllin, imiquimod immune modulator, trichloroacidic acid. Cryotherapy, freezing warts with liquid nitrogen. Laser therapy for extensive or refractory warts. Surgical excision for large persistent lesions. LEEP, loop electrosurgical excision procedure for SIN. Chemotherapy radiation for HPV-related cancers. Vaccination, prophylactic, e.g. Gardasil 9. Nursing management, provide education on HPV and safe sexual practices. Encourage vaccination and regular screening. Offer emotional support for anxiety or stigma. Assist with procedures, e.g. pap smears, cryotherapy. Monitor for side effects of topical agents. Promote follow-up care for dysplasia or malignancy. 15. Treatment options. For benign conditions, warts, topical treatments, podophylox, imiquimod, cryotherapy, laser ablation, surgical removal. For precancerous lesions, LEEP cone biopsy, cryosurgery, ablative laser treatment. For cancers, surgery, e.g. hysterectomy, chemoradiation, immunotherapy in advanced cancers. 16. Psychosocial interventions. 1. Individual counseling, help patients cope with the diagnosis. 2. Support groups, provide peer support and reduce stigma. 3. Sexual health education, improve awareness and reduce risky behaviors. 4. Partner counseling, facilitate communication and partner testing. 5. Mental health support, address depression, anxiety, and fear of cancer. NASH17 prevention, HPV vaccination, recommended for boys and girls starting at age 9. Ideally before the onset of sexual activity. Regular cervical screening, PAP and HPV tests. Condom use reduces but does not eliminate risk, limiting number of sexual partners. Smoking cessation to reduce persistence of infection, prompt treatment of precancerous lesions. Conclusion. HPV is a significant global health issue, responsible for a range of benign and malignant conditions. With effective vaccines and screening tools, HPV-related diseases are largely preventable. Health education, vaccination, and early diagnosis are critical. Nurses and healthcare providers play a vital role in prevention, management, and psychosocial support for affected individuals. A multidisciplinary and proactive approach is essential to reduce HPV. Thank you. Have a nice day.